Good afternoon, respected panelists. It's a privilege to have your presence at the third ELITS Healthcare Transformation Summit 2022, and we are looking forward to listening to your insightful views on the topic Transformations Driving Online Healthcare Ecosystem. COVID 19 has accelerated the pace of digital adoption and led to the growth of online healthcare services. The session will look into mapping the journey of online healthcare ecosystem and the roadmap for the transformations ahead. Let me introduce our panelists for today. We have with us Dr. Arun Chandan, Regional Director RFC NRI, NR1, NMPB Ministry of Ayush Government of India. He'll be joining us in a few seconds, in fact. Sri Bhaskar Kattamaneni, IAS Commissioner Health and Family Welfare, Mission Director, National Health Mission, Government of Andhra Pradesh. Welcome, sir. Sri Suvankar Pramanik, Senior Director and Deputy CIO Head, Digital Transformations, Manipal Health Enterprise Private Limited. Welcome, sir.
Thanks. Morning.
Good morning, sir. Sri Saji Matthew, Chief Operating Officer, Baby Memorial Hospital. Welcome, sir.
Thank you. Good afternoon.
Sri Bhupender Solanki, Head IT, Sakra Hospital. Welcome, sir.
Thank you.
Mr. Ravishankar M. Sankeswar, Chief Information Officer, KLES, Dr. Prabhakar Kore Hospital, MRC. Welcome, sir. And I'm your moderator, Tarannu Manjul. I'm the assistant editor at ELITS Technomedia. So we can, I think, start with the discussion now. And my first question would be to Mr. Do we have Mr. Bhaskar Kattamaneni with us? Can we have the entire screen? Okay, my first question would be to Mr. Shuvankar Pramanik. And Mr. Pramanik, I would like to know what have been the various initiatives that have facilitated us transition towards online healthcare in your enterprise?
Yeah, good afternoon to all of you. First of all, there are multiple things already there in the systems which has been accelerated very fast amount, and new things also happening, and basic teleconsultations and teleradiology has been promoted, and it is using rapidly. And other than this, there is a home care app we have started, and there is another follow-up of medicines, e-prescriptions, e-pharmacy app we have started. So there are multiple applications we have introduced in the system, and e-pharmacy we introduced for our chronic patients, for diabetics and other chronic patients also. And there is a POC state. There are a couple of projects also going on. And the next month it will be on live. Like there is a smart watch based tracker systems of the healthcare KPIs. So we have implemented all those things. And there is another digital your magazines, digital newspaper facilitated for the attendants and all the patients at their ward and different rooms also we have introduced. So these are the certain digital things we have implemented in our enterprise.
That's very interesting to know, sir. In fact, this question I would also ask Saji Matthew, sir, if you can also share about the various initiatives that have, facilitated our transition towards online healthcare in your hospital.
Yes, definitely. In the last 2 years, we have implemented various digital initiatives. We leverage technologies like AI, ML, voice to text, some of the cognitive capabilities of computing in providing a better care for the patients. That's in the patient engagement as well as the clinician engagement. Some of the examples are when the pandemic started way back in 2020 March itself. So we started to come with a symptom checker, online symptom checker, bilingual. which help the people to understand and give suggestions in so various treatment options. We made our entire OPD, that is the outpatient, a kind of zero touch. It's basically right from making an appointment, making online payment, coming here, doing a check-in, and also when they are here in the hospital, okay, going to pharmacy. Various touch points, we made it like a contactless by introducing various digital technologies. So we achieved that one. And also in the COVID care areas, we have introduced remote patient monitoring, and for the doctors and the nurses who are involved, and ensuring minimum risk for the people in terms of their contact with the COVID patients, like tele-ICU kind of using our own technology. I mean, it's using remote video and capturing voice from the various devices involved that we have done. And also in the home care front, we have a home care services that involves specimen collections, providing certain services at home, medicine delivery. This is all achieved through various technologies. We engage the patients through various channels. That's WhatsApp, that is interactive chatbot is available, and that is integrated to our backend ERP systems, and through the web channel, telephone. And telemedicine, we have been practicing right from 2016. We see very upsurge in terms of teleconsultation. And for the post-COVID or the discharge care also, now we use employee technology for providing post-discharge care also. We use conversational AI. Basically, it is checking on the patients in terms of their recovery. We send a daily questionnaire through WhatsApp, and from videos and other instructions for them to follow, medicine reminder in the case of various specific disease specific, that is for the cardiac recovery after angioplasty, what steps to follow, and also post-COVID care. So this has been our journey, and we are now piloting remote, using wearables in the wards, patient admitted. That is also basically do the vitals. So the nurses, rather than physically going and through a wearable collecting the vitals, panic buttons, and fall detection, and few other stuff also. And in terms of contacting the nurses also, nurses call systems by wearable devices. So that is our journey, and we could see a greater adoption on the clinician side also, because it's in the past when we introduced telemedicine. Initially, there were resistance, only a couple of youngsters were ready, but during the pandemic, we could see a greater adoption among all the doctors, irrespective of their age group, and patients also now. And we could see post the pandemic now, it is mostly focusing on certain areas. It is not one fit for all, but we know certainly this teleconsultation can be used typically for surgery preparations, reviews, and maybe first time the doctors feel comfortable to see a face-to-face meeting and consultation, but subsequent reviews and follow-ups can be online, and for surgery also a review or evaluation can be online, and for people who cannot travel, then this is an alternative. So that's the journey that we have, and we have been recognized also for the various digital initiatives by Confederation of Indian Industries and also IDC for the various digital initiatives we have taken. So it's a digital transformation journey.
That's very interesting to know, sir. In fact, you have some fine examples of digital transformation at your place. My next question now would be for Ravi Shankar, sir. And Ravi Shankar, sir, if you can just highlight the importance and potential of evolving digital health ecosystems. We had Ravi Shankar, sir, with us. Ravi Shankar, sir. We had Ravi Shankar, sir. Uh, I think I'll just pass this question to Bhupender Solanki ji then. Mr. Solanki, if you can just highlight the importance and potential of evolving digital health ecosystems.
Yeah, sure. Good afternoon, all. Yes, after this pandemic, there is a big change in the process of clinical care and the touchless transactions enablement. So digital transformation is a new way to deliver care, improve process, and meet the well-being needs of consumers. Digital transformation is building block of a patient-focused approach to healthcare. It will help healthcare providers streamline operations, understand what the patient requires, build loyalty and trust, and offer a better user experience. This online ecosystem is nothing but a infrastructure that supports the transformation of the organization centric healthcare model into patient centric model. IoT is the biggest player to play the major role in remote care or healthcare transformation. So this is my thought about the transformation with the help of IT in the healthcare segment.
That's very, very interesting to know, sir. Sir, now my question would be to Saji, sir, in fact. Saji, sir, how do you think, how should the implementation of digital health ecosystem should be approached?
Well, I would say so. The way we achieve this transformation is we leverage our startup ecosystem in Kerala. Many of these ideas, when we muted, the startup firms came, so we were able to implement many of these ideas at low cost using the startup ecosystem, and we involved our clinicians also. One of my colleague who is a doctor by profession, now he left his clinical practices. He is full time into technology. It's a few doctors are IT savvy, so their involvement helped me a lot. In the sense, okay, they come with the clinical ideas, the pain points, how things can be quickly transformed using digital technologies. Because it's doctors' involvement in this case is very important. So because we need to convince them, and by using this technology, both patients and the provider are going to be benefited, and these are the benefits. It's not going to take away their jobs, because what I would say, some kind of a loose talk in the industry. Okay, the technology is going to come take away your job. No, it is going to complement, augment their capabilities where they are doing very mundane tasks. So the technology is going to engage them and empower them, and where they can focus their knowledge and in providing a better care. So that way we engage our doctors. We could see a greater adoption among the clinicians, especially the younger groups, and also okay, leveraging. I mean, we know we have the technology, the platform ready, but how do we do a low cost incremental implementation? So the last 2 years, it is actually a journey. It's not like we implemented some products from a third party vendor. Rather, what we did is okay, we implemented in-house with the help of our IT team and this startup firms. So we did an incremental innovation approach. So we implemented something, took the feedback from our stakeholders, then we tried to improve, introduce the one after the various initiatives. We could see, okay, that helped us there. So it's what I would suggest is also when we approach the implementation, the digital transformation from an incremental innovation approach, there is a greater chance of adoption among the various stakeholders rather than forcing it on people. So they should see need to realize the benefits. Then we bring in the next initiative one after the other. Definitely, that ecosystem will get developed, and so that will eventually will provide a better care for the patients in the all areas of care delivery. Various new models are also evolving as we discussed, and also the providers who are the main stakeholders in this, they will also feel comfortable how technology is going to help them augment their core capabilities. Their core capability falls in terms of diagnosing or doing interventions, not in doing this kind of a mundane task. It's doing a uh, when somebody comes, okay, if you have to collect all the patient history, maybe machine through a conversational AI will be able to collect all the data entry, information capturing can be done using a clinical decision support. All the information available in the medical knowledge can be brought together. So we prove to them that one. So the technology is going to help them in those areas to provide a better care. That has been our
That's
experience in implementing.
that was very interesting, sir, because and in fact you raised a very You shared a very important point that there was a lot of chaos related to this, and a lot of bad word about technology would be replacing humans, and actually the people were not very pro to taking up technology. I would in fact ask the same question to Shivankar sir as well, sir. Shivankar sir, what are your views on how should the implementation of digital health ecosystem should be approached? Sir, your audio is
Sorry, you are
yeah.
correctly told that there is a definite some bad experience, and definitely some ecosystem change basically from patient perspective. And when you are introducing any kind of digital ecosystems, then definitely that should be a kind of some philosophy, and a like it should be very personalized here. And when you are giving to patients a very personalized care, you can be involved with their emotions, you can be involved with their psychology, then this will be much more effective. As well as in the healthcare sector, it's very complex. And first, the psychology and the feeling works with these services, and you have to reduce that. You have to come up with those kind of feelings, like a patient's talking to a consultant. It's like he or she is talking to the consultant, just like across the table. You have to get that feeling. Number one. Number two, definitely. Since it's a clinician's adaptability act, as already said, and it is much more data based, accurate care. So physicians now is adapting because they know the accuracy is coming. So whenever a system is introduced, the facts, the figures should be very accurate, since it's a healthcare domain. And it's a habit, as soon as like initial days, everyone just get out of the home with your physical currencies and coins, etc. Now they are okay. They can spend the whole day with your phone, Paytm app, like different digital apps. Also, it's a habit. Now they are much more comfortable with that kind of technologies. So you have to make this as a habit to the customer, your patients. So once it will be habit, then this adaptability will be there. And more of all, your own ecosystems, your own organization should be tech savvy and tech enabled mindset. It is not a business. If it comes from a business side, like if I introduce some app, what will be the ROI kind of things? That's a different issue. Business is there, but you have to come with that vision. When the vision is works, definitely this will be implemented very easily in your ecosystem, which I believe, and we used to do in that way.
That was very interesting. In fact, sir, when you shared that it all has to be in the mindset and it has to come in the system itself. That was very important point which you raised. Now, if I can ask Bhupender Solanki, sir, if you can just share about your experience of the transition towards digital health, especially that happened during the pandemic, your experience and maybe some initiatives that you had taken.
Yes, yes, definitely. I would like to share here. Before pandemic, traditional things are going on, and sometimes video consultation is happening. But after this COVID in India, it's introduced in March 2020. So that time, that huge pressure is coming for touchless transactions and remote care. Then just 1 year ago, we started the home care service. So we focused more on that, and this video consultation facility started in robust manner. But same time, like external customer, or we can say our patient, we have to provide those touchless transactions. Same way, we have to take care our internal employees. So for internal employees to take care, like they are feeling feverish or something, we developed one application, and they enable on their mobile, and before coming to hospital, they can feed what they are feeling today. So that information going to their HODs, and HOD can decide if something abnormal found in it. So that way we take care of our employees. So in first wave, hardly 1% employees got positive. Otherwise, rest done the clinical care towards all the patients who admitted in Sakra. One thing. Apart from this, many other things we started during this pandemic to understand the requirement from the customer side and from the organization. So in this, like we enabled registration, HIS registration. HIS, hopefully everybody knows that this is a backbone of each hospital. Without this, this ecosystem can't be formed. So that HIS is the biggest role player or backbone of the ecosystem in healthcare. So in HIS, whenever new patient coming to hospitals, that registration is required, unique ID, hospital ID. We enabled through the internet or online registration, so they can do that registration from their home or their mobile, or even they have not visit to this desk that way. Similarly, for COVID patient in various stages, consent is required. Consent means hard copy, and then they have to sign on it. First they read and sign. So that is the paper exchange, and there is a possibility to transfer the COVID infection to each other. So we enabled this e-consent, and e-consent going to the patient mobile, registered mobile number. They can read and they can simply say, I am fine, they take and apply, then it will coming back to the HIS. Similarly, online billing, we made one portal and given to them, then vaccination, COVID-19 tests, diagnostics, these services we enabled, which is a very generic or to the patient. So patient can do the billing from their end. So first they can do, if they are a new patient, register, then billing. Similarly, online reports, online bills, and this, and one more application we made for the COVID patient in second wave. When second wave, huge demand is there for the beds. So it is difficult to find out the real time how many beds we have free, or in 1 hour going to free, like that. So we developed one application on top of HIS, and we take out that information going to the doctor's mobile, and the operational team, they are managing the in better manner the bed management, as well as the request which is coming from the patient side, or BBMP in Bangalore, BBMP is there. So we are accumulating according to the their criticality or saturation level. So that application we developed, and that helps a lot in second wave. Internally, one application we develop, abnormal value. If any patient having inpatient or outpatient having abnormal values, so that previous processes, laboratory person has to inform the doctor through phone or through normal SMS. But we automate from the system. Once that abnormal value coming to the system, then system only generate the trigger to respective doctor, treating doctor, and doctor can see and give the prompt clinical care to the patient. So that helps a lot, and appreciated by our doctors. And remote payment, touchless transaction, like all the option we brought in 2020 only, this for payment. So patient can do the payment from home. That SMS will go and they can do. Before that, they have to visit the hospital and do the payment through credit card or static QR code. So many things we done. Now we are implementing like patient engagement tool, mobile app. We talk about mobile app. So backbone is HIS, but on top of that, in healthcare, many applications are coming. Now we are moving to NDHM and this Ayushman Bharat. So for those to come on those platform, each hospital has to make their single bank of data. Otherwise, it is difficult to come to those platforms. So single data should be there like HIS. If HIS is not strong, they have to think about it. So single data will help to move to government oriented programs. One thing. Second, like we are implementing mobile app patient engagement tool, it is, and this chat bot. So chat bot we are implementing for all four channels like web chat, WhatsApp chat, Facebook, and Instagram. So these are in implementation mode. Yes, mobile app. If you see in any organization in India, so what is this VC video consultation you can do, appointment you can take, few mobile app having the payment gateway as well, so they can do the payment then and there. But it is not the in holistic way. patient, we have to engage the patient with our application. So application should be user friendly, or it should provide more information to the towards the patient so they can retain. Otherwise, for one appointment, they will install and uninstall the mobile app. So that is not going to uh, serve our purpose. So what we thought, we bringing in mobile app almost whatever possible as of now, like pediatric vaccination, OBG tracker, 9 month period is there. So in that period, they can track themselves completely, and whatever information, like they are feeling pain, they are feeling hazy, sorry, and dizzying, so they can put into that application that real time information will go to the treating doctor, and treating doctor can consult over the mobile app only to the patient. And this dialysis management, these things we are bringing into mobile apps, so that person will not going to uninstall, they will be happy. And that those normal things we are already put it, like their bills, their reports, and their daily symptoms. If they want to feed daily symptoms, like today I am feeling cough, so I can mark like mild cough I am having. So whenever he is visiting to the hospital after 1 month, 2 months, so doctor can see, okay, sir, 1 month ago you have a cough, so now you are feeling okay. So that way they can check. So those things, those catchy things, or useful to the patient, we have to bring our application. Otherwise, people will use and uninstall, or they are not going to use. So that is our thought process, and we are trying to bringing in one platform. Consolidation of services also much needed. Otherwise, you can't provide the better service towards the patient, because like appointment system you have a different, queue system you have a different, feedback system you have a different. So different system need integration. If integration not working, data will not flow to the HIS. So all these things need to think, each CIO, each organization, and then decide the ecosystem, digital healthcare, to bring the hospital in new era. So that is my thought process.
That was very interesting, sir. In fact, when you shared all the details about the practices that your hospital has undertaken, I think it can be a very fine example for many other medical services as well, on how patient care can be completely and comprehensively brought together on a single platform using digital technology. Now, my question is to Saji sir. If I can just ask you about the challenges that came through during this transformation from manual to digital during the pandemic, especially because there was a shortage of manual labor as well. So, what were the challenges that were faced by you?
Um, a couple of challenges. One, in terms of the resource availability, as you said. So then we leverage. I mean, having the right resources to, you have ideas, but you need somebody to program it and to make it work. We That is where we leverage the startup ecosystem. So there are startup firms, and so we leverage them. I'm part of the Kerala startup machine as a mentor there. So we leverage the startup ecosystem in terms of providing with the technical help or assistance. And so that was one of the challenges. And the initial stage, it is the even our own employees availability. So that is where we introduce certain technologies for them, for the staff members itself to benefit out of it, is in the sense, okay, to minimize the contacts, because one of the cardinal principles here is to social distancing. How do we use technology to enable social distancing in terms of, as one of my previous panelists highlighted, okay, you don't want to exchange papers, because that is also a source of infection, cross contamination or infection. So then uses digital ways to exchange information, that's between within the hospital, and also to exchange information to the district health authorities. We were required to report on a daily basis um, the number of beds available, other resources like oxygen, ventilators, all those things we were supposed to know, the number of patients who are getting admitted. So we then again, we have resource constraints, then we introduce this RPA kind of technology, so that from pull the data from our HIS, and then fill up the web forms which are available in the government sites. So it's, we leverage startup ecosystem in terms of the resource challenges where we had, and then okay, we leverage technology itself to overcome some of the areas where we have a resource constraint. Then definitely in terms of creating awareness and educating people on that one. Again, we leverage technology. We created videos and animated things and shared through YouTube and videos being created. That is in terms of educating in the care delivery area as well as in terms of using the technology itself. So that's how we overcome some of the challenges. Yes, we had a fair bit of challenges. Yes, of course, but then motivating the people to stay together. So we those are like some of the HR strategy we applied. Okay, in those initial days, some of the senior members will come record or give a message to motivate people, and we were going through a very like the in terms of the occupancy almost 20% in terms of IP and OP were kind of zero except for um, the COVID patients. So in terms of we went through the financial challenges also. Then we stayed together. The senior management team got involved, engaged our staff members, and also we engaged patients using technology. Yes, we had challenges, but we worked together. The staff played a role, and the management also played their fair bit of role in it.
That's very interesting. In fact, because you shed very interesting light on the challenges. And if I can just continue with you, sir, and just ask you, what was the perception of the public and the providers towards this transformation?
For the public perspective, if I look at in terms of the percentage wise, okay, the consultation maybe 20 percentage of now our OP consultation happens through the tele platform. And in terms of payment, there is a greater adoption. People don't want to exchange currencies. Around 80 percentage is now digital payments, not exchanging of currency. That is either through swiping your card, but more and more people are now using UPI payment. So that is by either through a dynamic QR or a static QR. So they just use us or use going to the website and using the payment gateway. So on the payment front, we could see a greater adoption and staff members. Many of the programs were all now virtual. The training programs, it's 100% adoption and all the staff interaction. So we prior to that itself, we had a employee self-service app from the HR side. So that is not a big challenge, but we augmented that with all the training materials, created links, and we leveraged the existing technologies. All the training awareness programs were also created. So among the staff, I would say it's 100% on the digital platform. Maybe a couple of senior consultants, they are still, at this age, they don't want to change much. But there also we augmented them with the secretaries or physician assistant to help them with the digital adoption. But I would say staff, greater percentage, 80-90% of the staff members are on digital ecosystem. Patient-wise, it's in various fronts. It's OP 20-25%. It's on that one. So they do online booking, various means of engaging online way. And others, the seniors, they still prefer to make a phone call or visit the hospital, take the treatment. For the IP also, now we have done, okay, including all the room services. So previously we kept all the printed brochures and other stuff for their while they are admitted, the menu, the TV channels, all the information they can see. So now we taken to a digital front. So we just keep a QR code, they scan it, or they get all the information in the fingerprint. That is well accepted. So that's in terms of the patient or the staff adoption. So that's our experience.
That was very interesting to know, sir. We have been joined by Shri Bhaskar Kattamaneni. He's the Commissioner, Health and Family Welfare, and also the Mission Director for National Health Mission, Government of Andhra Pradesh. I would like to welcome you, sir. And in fact, now I can ask this question to you, Bhaskar sir, that what have been the various initiatives that have facilitated a transition towards online healthcare in Andhra Pradesh? If you can share with us.
Uh, Thank you, ma'am, and thank you for having me on the panel. And sorry for the delay. We had a medical emergency, so some major issue happened, so I had to rush there, and then I have come back. So that apart, Major initiatives in terms of health using technology. I would say the first and foremost is that it's exciting times in the sense that there are two things that have happened during the COVID. Was the acceptance of telemedicine as an alternative, would say technology or alternative methodology for accessing services. So we took it up as in a big way. In fact, I am proud to say that around 45% of total telemedicine calls are made in the state of Andhra Pradesh. Last week we touched the first 1 crore mark. So 1 crore calls have been made in the state of Andhra Pradesh in the last 8 months by the people seeking telemedicine services. So, and we are engaging with our government health service providers as well as the patients who are seeking healthcare. And two or three things that we have seen is that one biggest advantage of telemedicine is that, in fact, I would say that telemedicine is not going to take away the services from the regular health system. The entire telemedicine experience in Andhra has been is that telemedicine is slowly going and occupying the space of services which were being provided by the so-called RMPs or quacks, which is a good thing. Now at least there is a qualified doctor available to which patients speak and get medical help. But we have experienced that for a proper inpatient care, there is no shortcut to having a good healthcare system, doctors, beds availability. That physical infrastructure cannot be taken away. So telemedicine has been one successful venture in our state, as we said that. And we are aiming to take up this up to around 3 to 4 lakh calls a day. Currently, our call load is 80,000 per day. So, but we have hit a kind of a ceiling in that sense that the number of doctors available on telemedicine and our bandwidth is limited. So, in the next 2 months, we are increasing the bandwidth in such a way that this will go up to 3 lakhs per day. So, we are roughly looking at servicing every patient who calls up the telemedicine hubs. So we operate currently 28 hubs. That will be going up very drastically, and the bandwidth also will be increased. Second important thing that has happened during the last 4 months is that Government of India has come up with digital health mission. So we immediately latched onto the digital health mission and started the work. I'm happy to announce that till date we have created health ID, unique health IDs to around 1 crore population. So, and simultaneously, our model is slightly different from what other states are doing. So, we not only are creating digital health ID, but the entire digital health records available for that patient are being simultaneously synchronized to this health ID. That today, if I create health ID for a citizen, it is not a standalone health ID. So all the digital health records available in the system of that patient are all synced to that digital health ID then and there itself, so that immediately services can be given. And we have started using the digital health ID also in different ways, in the sense that our different health programs, the outpatient clinics at the urban clinics, we have started using the digital health ID. Is that the incremental new data is also getting synced to the digital health ID, so that citizens need not carry any health records, and in fact, all the diagnostic reports and all the pharmacy reports as well as the dispensation of drugs, everything has been now linked to the digital health ID. So that has been quite a satisfying journey. Apart from that, we have been implementing HMIS. So we started with few of the larger hospitals. I think in the next 6 months, all the hospitals in the state, from the largest teaching hospitals to the smallest village clinics, will be totally be digitized with HMIS, with the digital health ID at the backbone integrating, so that patients are not made to do the same diagnostic tests again and again, and there will be a large amount of accountability. And onto the digital health bandwagon, I'm happy to inform that all our government health practitioners are already registered. All our government health facilities are already registered, and all the services that we are going to give in these facilities will be on a digital platform. And we are yet to bring the private sector into this. We'll be working with the private sector. Though it is optional today for the private sector to use the digital health ID and to digitize everything, but over a period of time, I'm hopeful that we'll work with them to bring everything on board for them also, so that it really becomes a seamless experience. Because today our health insurance scheme we have totally digitized and brought into the digital platform along with the digital health ID. Our field workers data is also now synced with the digital health ID. Just a matter of time, the private hospitals are also brought into the system, so that the entire the fruits of the entire process are borne by the patients, even when they move from government sector to private sector and vice versa while availing services.
Sir, in fact, you shared very insightful details about the practices that are being done in Andhra Pradesh right now, and in fact, during the pandemic as well. If you can just also share about the challenges that the Andhra government and your department faced while having this transformation and implementing all these measures, the major challenges that you guys must have faced.
The major challenge is the change management. Anything new is really challenging, and the stakeholders who are there in the system, uh, they wouldn't appreciate thing because they don't get the big picture. Everybody looks at the smaller, their part of the pie, how they are affected. Even getting all the government doctors into the health registry, health professional registry was difficult because there was a lot of apprehension. There could be a lot of medical legal cases. In all the decisions that we have taken earlier, we used to write on a piece of paper, and then that piece of paper is there in the system. Now everything will be digital. We will be accountable. Whatever prescriptions we have written, whatever diagnostic tests we have prescribed, everything will become accountable. So there was a lot of apprehension and a lot of resistance also. It was very quite painful to overcome the resistance and all. But slowly over a period of time, in fact, we started this journey. It took us 1 year to convince our people to come, and it took only 3-4 months to do the digitization work. So I would feel that 70 to 85% of the time would be taken and effort would be taken in convincing everybody to come onto the platform. And once everybody is convinced, in fact, the early adopters, we find that though there were a lot of opposition, now they are appreciating that a lot of drudgery and a lot of work of writing long reports is now has come down. But still, there are a number of people, particularly the health professionals who are a little older in age, who are not fully into the digital way of living, are finding it a little challenging to get accustomed to the new way of life. Thank you.
In fact, now it's like just winding up because we are heading towards the end of the panel discussion. But this question would be open to all our panelists, and I would start with Saji Matthew, sir. How do you see the future of online healthcare ecosystem in our country?
I see a hybrid model evolving as already been discussed. So it will be both digital as well as brick and mortar, because a certain intervention, certain treatment need patient to be admitted as surgical or other intervention need to be done. But many other areas, and we have the largest NCD, that's the non-communicable burden in the country. Many of those chronic diseases can be very well managed through using digital therapy. It is going to be, there will be newer ways of care delivery models will be evolving. So I would say end of the day, it is a hybrid model, a connected health ecosystem evolving, connecting the patient who are the ultimate beneficiary, the providers, government, the regulators, various other stakeholders like the payer insurance companies, people involved in the supply chain. So all will be connected in a digital, a truly digital ecosystem with a hybrid kind of delivery model.
That was
That's my.
interesting. That was interesting to know, sir. And the same question to Mr. Bhupen Solanki. Bhupen, sir, how do you see the future of online healthcare ecosystem in our country?
Yes, future is bright for the online healthcare in our country because we have a largest almost this population, and the reachability is very less to the rural area. So in that manner, this with the help of online platform, we can reach to even end of the corner of our country. So and e-ICU, or there is a two model actually. There are, one is B2B, one is B2C. So healthcare in the metro cities or bigger cities, they are providing B2C healthcare. But B2B also possible, like remote people are making the nursing home care, small clinics in the remote area. So big hospital can they tie up with them, and through the digital platform they can give their expertise or expert consultation to them, and then right treatment can be start then and there. If still some big surgery or something is required, so they can come. So online platform will going to help a lot, and future is bright in India as well as the globe. But yes, we have to work in that manner, that adherence should be there. People should not use for once or twice and leave it, and then coming to the hospital, or searching the tier 2 or tier 3 type of hospital. So in that segment, we have to think and make our treatment or our this healthcare clinical care services affordable to the tier 2 or tier 3 cities. So this digital platform will be having the bright future in our country as well as globe.
Thank you so much, sir. And the same question to Shivankar sir as well. Shivankar sir, what do you see the future of online healthcare ecosystem in our country?
Yeah, definitely there is a need from consumer sides also, and this is the easiest way how government sectors can reach to the remote area. So everyone will now looks on these pathways only. I'm giving you some sort of figure. It's just a very basic figure. Like after implementations of digital health, it is, I think, almost 57% increase in workforce productivity we have seen. Even 57%, near about 56 point something, is saving the cost of care also. And it's, if you see from business perspective, it's a 36% already growth in the digital business in healthcare particularly. So there is a business requirement always there, and where India is a big market for selling this product also, and gradually it will come up from that sense also. Now they will spread in that way, and government will already taken all these initiatives. Different state governments also taking those initiatives, because this is the only way to reach the remote area. There is no other way to improve your infrastructure even.
Thank you, sir. And the same views I would like to ask from Bhaskar sir as well. Bhaskar sir, where do you see the future of online healthcare ecosystem in the country?
It's quite promising, but I would like to state the same with a little bit of caution. Uh, See, for advanced countries, the online system would really be an icing on the cake. But for us, large parts of the country, the cake is missing. You don't have doctors, you don't have nursing homes, and particularly in the government sector, the infrastructure is really bad. Unless we improve that, so we cannot expect the online system to really take off. For everything, you actually require the brick and mortar backbone over which we can build any digital ecosystem. So that would be my note of caution, in the sense that we need to continuously keep on investing in physical infrastructure as well as human resources, particularly human resources. Digital health ecosystem might be able to reduce the burden on the physical infrastructure, but human resources definitely not, because uh, as a digital health ecosystem improves, health seeking behavior will increase. Earlier, if 100 people were seeking health services, that would go up to 1,000. That we have seen. Now, earlier, people would postpone a visit to a doctor, and now, because of telehealth services available, at the top of the head, they are calling. And we find that these calls, there are large number of calls which are very, very simple, which doesn't require a clinical intervention also. But still, people are calling, and we are happy that they are calling. So this health-seeking behavior is increasing. Since the health-seeking behavior increases, the number of professionals required to manage even the telecalls will definitely increase. So governments and even private sector have to continuously invest on the human resources. Large number of doctors. The number of doctors that we today have is grossly inadequate. Nursing staff is also grossly inadequate. Technology may be a force multiplier, will be able to do certain things, but it is not going to do everything. So we need to have more medical colleges, more medical graduates, postgraduates coming out, more nursing graduates coming out. Definitely, that has to keep on improving, and technology will be a enabler and will be making these services more accessible to the people whom didn't access them earlier. So the volumes will increase definitely. So I think it is a catching up game. So even if we use technology, we'll be short of providing the services to the fullest. So the investment in HR and investment in physical infrastructure definitely has to go hand in hand. Thank you.
That was a very pertinent point, sir, that the investment has to be in the infrastructure and in manpower as well, because infrastructure and manpower, without both of these things, any kind of digital technology or transformation would not be possible in a complete manner. And that was a very wonderful discussion. We heard so many insightful thoughts from all of our panelists. Before ending this session, I would like to inform the esteemed gathering about two of our upcoming events. The fourth Diagnostic Leadership Summit, which is scheduled for 22nd and 23rd of March 2022, and the second Pharma Leadership Summit, that is scheduled for 26th and 27th April 2022. And I would like to now thank all our panelists today here who have spared some time and given us such wonderful thoughts on the digital healthcare system and the ecosystem, and how the challenges have come across, how they have in their own way have faced these challenges, how they have made the transition very smooth, not just for their internal staff and their the people around, but also for the consumer, to make it more easier and healthcare more accessible to everyone. I can just ask my team to give a token of gratitude through certificates to all our speakers now. The certificate would be for Bhaskar Katamneni, sir.
Thank you,
Thank
ma'am.
you so much, sir. Thank you so much for your valuable time, sir. A certificate for Saji Matthew, sir. Thank you, Saji, sir, for being so cooperative and for your time. A
Thank you.
certificate for Mr. Bhupender Solanki.
Thank you, Mr. Anam. Thank you, viewers.
Thank you, sir. And thank you for Shubhankar Pramanik, sir.
Thank you.
Thank you to all our panelists. In fact, those who could not make it, it's perfectly fine. But we had a wonderful discussion with you all. And thank you for sharing your thoughts. Thank you so much, sir.
Thank you.
Thank
Bye.
you. Thank you, viewers.
Thank you.
Bye.
Bye.